come at you about every other Thursday evening here at 8 o'clock Central. And would just love to know who's out there tonight. So if you want to just put in your first name, where you're from, just love to see who's out there and joining us here this evening, as well as let everybody else know who's out there. And if you're just checking this out or you just stumbled across this live stream by chance, I want to let you know that my passion as Keith RN is to create clinical reasoning resources that really help students develop and practice over and over the clinical reasoning required for safe clinical judgment, as well as then practice that will prepare them both for practice and licensure. And so I've developed numerous case studies and other resources to empower educators to accomplish this needed goal. I want to let you know that tonight's Facebook Live is recorded. And if you go to my Facebook page, Keith RN, Think Like a Nurse, there is a video tab in the middle of that Facebook. You can just go to the headers there in the middle of the page, and you'll see videos. And this is archived with a link. And I have other topics that you can also access. Just 2 weeks ago, I had a great conversation with Jane Morrow from Central Oregon Community College. We talked about how you can adapt unfolding case studies that I've developed, as well as other innovative strategies that Jane has used to strengthen fundamental instruction. So be sure to check that out and be aware that it's there for you. I also just want to let you know that I'm also the administrator for a Facebook group where I came across tonight's guest, and it's called Teachers Transforming Nursing Education. And the title of the group says it all. We're a community of educators, now 6,500 plus from around the United States, Canada, and other parts of the world. That really is a supportive community to innovate and transform how nursing is taught. We share tools, resources, as well as the collective wisdom that many of our educators got lifetime of experience. And so if you're a new educator, you're struggling, or you have any question, you will get immediate support. So please check it out and go to that community, check out that Facebook group, and just let me know that you're an educator, and I'll give you access and let you inside. And so I want to introduce tonight's guest. His name is Sam Womble, and he is not an educator, but he has something to tell us as educators, because he is a recent graduate of a nursing program in Missouri and received his BSN just 2 years ago, and had his experience in a acute care step-down unit. He's also a seminary student presently and is working full-time towards working in the ministry, and also hoping to go to the mission field where he can use both skills as a pastoral counselor as well as a nurse with his wife, who is also a registered nurse. But the reason I came across Sam is that one of the educators in the Facebook group shared a link to his book that he actually is writing, had a GoFundMe page, and it was about preparing for practice. And with Sam, as I've had a chance to connect with him, you know, he learned the ropes of transitioning to practice, navigating reality shock the hard way. And there's a lot of pearls that he learned in his journey. In fact, he loved working with students in the hospital where he worked at, and he shared these pearls with his students. He loves students like I do. And the bottom line is they really valued his insights, and that spurred him to say, I should write a book. So he's written a self-published book that will be coming out early next year, and we'll kind of share some more information about that. But the bottom line is, I'm just really excited to have with us tonight basically one of our former students who is now a nurse in practice. And Sam, it's a blessing to have you with us tonight.
Yeah, thank you so much. Happy to be here.
And, you know, I just like to know, Sam, you know, it's one of the questions we ask almost every educator as well as any nurse, but we all have a journey. We all have a story. You know, what first interested you to become a nurse?
Yeah. So I love to talk about it. Actually, it starts when I was 6 years old. And actually, a couple years before that, my family and I, my parents are missionaries. And so we moved over to Pakistan. And well, anyways, fast forward a couple years, and when I was 6, we were at our church there in Pakistan, and me and my mom and my dad were upstairs in the service when a terrorist entered our church with grenades. And basically, long story short, he ended up killing himself and 4 other people. My dad, when the chaos settled, found me about 15 feet away from them with just a huge gash in the back of my skull, and it's just surrounded with a pool of blood. And he picked me up, and he didn't think I was going to make it. And to spare all the details, basically, my family was medically evacuated to Wiesbaden in Germany. They have some of the best pediatric brain surgeons there. And I had to have 2 brain surgeries as a 6-year-old kid. The first was to just put my skull back together with staples. And then the second was to get some of the shrapnel that had penetrated into my brain, and to also help with the infection. And so it was while I was there in the hospital as a 6-year-old kid, and I just saw what nurses could accomplish, that holistic care of just caring for someone spiritually, emotionally, physically, and mentally. And we moved back to the States afterwards, after recovering. And it was there when I was 7 years old. I told my dad, I want to be a medical missionary, and specifically, I want to be a nurse. And it really comes down to just the way that those nurses had impacted me. I still have some of the toys they gave me as a kid, and just the lifelong impact that they were able to have on me. And I knew that I wanted to do that for other people. So I saw it more than just a job, but really as a ministry opportunity. And I loved it. It's been great so far.
Awesome. And, as a student, Sam, you basically, what I really love to kind of get a sense of is that, we can always learn from our journey and our experience in nursing education. And, you struggled with some of the transition pieces. You had the passion to be the nurse, but nursing school was a struggle in certain aspects. And I would just like to know kind of the high and lows, and recognize that our audience is nurse educators. So you have a perspective that we need to listen to and consider. And so I'd love to know, just kind of in your program, what did the program do well, but where did you feel that they really, could have done better to kind of help that transition after you graduate? You passed the NCLEX, now it's reality shock. Now
Right.
It's not nursing education with 1 or 2 patients anymore. So I'd just like to get your perspectives on that for our audience, please.
Yeah, sure. So I just a little background. I went to College of the Ozarks in Branson, Missouri, and we had about 60 students that we started with, and only about 15 who ended up graduating. I think we had about 200 to 300 more clinical hours than most of the other colleges and programs. It was very hard, definitely. I think a lot of the good things that they really did well with was obviously the extra clinical hours. For me, I started without any experience. Like my story, I said I wanted to be a nurse, but I had no idea what that entailed. I didn't even know. I moved from Thailand, where my parents were missionaries. I didn't even know anyone in Missouri, and so I got into the nursing program. Hadn't shadowed, hadn't done anything like that, and everyone talks about it being really hard. I think it definitely is hard, but it's definitely manageable. And some of my favorite memories were just the intensity there behind the clinicals. And especially the preceptorship with the capstone, or capstone is what some people call it. I actually took a job I did a summer internship on the ICU a year before I graduated. And then that next semester, they wanted to place me for my capstone in a different unit to kind of get some more experience. And I didn't see it at the time, but I think my instructor, just kind of knowing to try to make us more well-rounded, she had me work on the step-down unit. And it turns out I actually ended up switching over from the ICU to work on the step-down unit when I graduated. And so I think a big part of that was just being able to notice, just that well-roundedness of a nurse. The nursing program there was also very, very holistic, very spiritual. So obviously religion and just caring for someone spiritually was a big deal. And so I think, also just the holistic care that they really pushed for was a big part of just my learning experience.
And you have an interesting perspective. We'll talk about the book that you wrote here in just a little bit. Well, towards the end of, in some aspects of what you talk about, how, does it have to be so hard? And that everyone's just like this somberness of like, like the sky is falling as students, and that stress, and everyone is just kind of like, just like it has to be a somber, like just an enduring versus a thriving. And so you kind of saw it a little differently, and just like to get your thoughts and kind of what you share in your book. But what was your journey with that, and kind of how did you counter some of that negativity that's very endemic, as it is hard, it is difficult, But what was your approach that kind of kept you above that and not go under?
Sure, sure. Yeah, so I talk about it in my book, but I think one of the best ways that I noticed, and I want to help newer nurses and students understand, is just the aspect of remembering your why, is what I call it. And so when things get hard, whether that's in school or whether it's in practice, just reflecting on why you wanted to be a nurse in the first place. Because I think obviously nursing for it's not like it's not going to make you a millionaire. You know, you're caring for people in some really hard and difficult situations. And so most people, I would assume, wouldn't go into it for selfish reasons, right? And so I think just remembering and reflecting on that why, whether it's spiritual because you feel like it could be a ministry, or just maybe, I know a lot of people go into nursing because they had a family member, and they experienced the healthcare world through them, just seeing the way someone cared for their family member. So just reflecting on those things, I think, is what keeps people their spirits high and the passion, because it's obviously really easy to burn out. But I think reflecting on that why is definitely the biggest thing that I had for me.
Yeah, and I kind of encourage, educators to help students even like write a mission statement as a nursing student, which captures your why. A mission statement is your purpose. What are you doing this for? And what do you want to be as the kind of nurse at the end of the program? And so really incorporating that why and reminding yourself, you need to write this down, Sam, or at least remind yourself on almost a daily basis. Wouldn't you agree?
Definitely.
Yeah. I'd also like to know, since we're both, kind of nurses, male nurses in the profession, a minority, about 10% of the profession currently, but I really love to kind of get a sense as far as your experience recently as a male nursing student, because in the literature of nursing, male students are one of the highest at-risk demographics or categories of people who are going to fail to complete the program. And so there's some unique stresses. I'm just kind of curious, as a male student, was there anything that you kind of experienced that was maybe just a little bit like, was either a positive or that could have been done differently to kind of support you as a minority participant in the program?
Sure. Yeah. I think one of the biggest things is just the male nurse representation. My entire program, and it obviously wasn't done on purpose. There's just not as many male nurses, but especially in the education side. But I think a huge part of that would just be having some type of male representation for, obviously guys and girls, our brains are wired differently. We think differently, we process and we practice differently. And so I think just that understanding of it doesn't have to always be this way. I think unintentionally, a lot of programs are centered towards understanding that more from a female brain. Just with even, some of the reading that you do, it refers to the nurse as her. And even just like little things like that, you don't really think about that kind of maybe make it seem more exclusive for females. So I think just a lot more male representation. I loved how my school, they would try to pair us, the male nurses, with male nurses on the field. And so we were able to really understand how they handle things. Because guys and girls just think differently, and it's not better one way or the other. But I think they did really well to kind of help us understand the way that the male nurses practice. And you have that automatic connection. I remember going into my clinicals and even my preceptorship. The nurse I followed, his name was Ricky, and I just remember being so happy getting to follow a nurse for that 4 or 5 months that I was in my nurse residency. And there's just a connection there. And if there's not enough male representation, it's not. I don't know if I'd say it's lacking. It's just it's a bonus. I think I would say it's definitely a bonus.
Yeah. And you bring out 2 points I'd like to highlight for educators that are actually in the nursing literature. And that is that it really is best practice to support the male students by having them work with a male nurse on the floor whenever possible, because they really do need that mentoring by a male, who was of the same gender. Really helps kind of that enculturation and kind of say it's okay to be a dude and nurse, and to see that validation and that support is really a positive thing because of that role modeling that, unfortunately, in nursing education, there are not a lot of male faculty for a lot of different reasons. And so therefore, just wanted to highlight that. So if you're a clinical instructor and you've got male nurses on the floor, whenever possible, pairing your male student with that as your nurse is really best practice. And I think you saw the positive benefit of that, Sam, didn't you? So what I'd like to go on to the next question, Sam, is this. I'd like to know your first position after graduation. What was the most difficult aspect of that transition to real world practice? You're now working acute care. The stakes are high. How many patients did you have? And just what was the most difficult thing looking back at that journey of transition? Can you hear me, Sam? Oh no, did we lose the audio? Um, Sam, can you hear me? Oh, Sam, let's just see my connection. Okay, well, let's try again here. This connection is going out. So again, just like all of us educators who work in Zoom land, we know that sometimes technology is our friend. Sometimes it can be kind of one of our greater adversaries. And so we're just going to go back in and out. And basically, we'll, kind of being an ER nurse, I'll try to be flexible here for just a moment. And, bottom line is that, I think it's important. I'll just kind of highlight just a couple things and just, as it relates to just the male experience in nursing, that role modeling is really, really important. And I just want to highlight that, the way that, one of the interesting distinctives, I think it's really important for faculty to know is how men and women even communicate caring slightly differently because of their gender. And so those expectations of what caring behavior looks like, women, for example, are much more likely to use touch and default to using physical touch in the context of patient care, while male students are much more likely to really use humor. They're not going to default to touch. But when you see male nurses or your students kind of having that kind of rapport, that getting that they're just kind of back and forth, that's just kind of maybe a little bit of humor involved with that, that really is best practice. And so just something to definitely just be aware of. Another thing to consider too is the vulnerability that male students experience with intimate care and intimate touch with women. So for example, whether it be any form of pericare or where there is, any dynamic, male, whether regardless of the age of the patient, male students and male nurses are inherently vulnerable in that because of any misperception or anything that could be perceived. And so there's some really important skills that we can teach our male students regarding kind of mitigating some of these landmines. For example, always asking permission to do intimate care when it's a woman. So whether it's, doing pericare as an example, or inserting a urinary catheter, that the male nurse is always asking permission. Are you comfortable doing this? Or are you comfortable with me doing this? Or would you prefer a woman? And you're just giving them a choice. And when they choose, say, no problem, go ahead and do it. Then you know that vulnerability has been mitigated and you can feel much more comfortable doing a procedure or personal hygiene. But if there's any hesitation, it's really important to just, in essence, get that permission. If they're not comfortable, then you just basically pull out another colleague, another woman, and you do some things for them while they kind of go and do that. And you can mitigate that vulnerability by encouraging and teaching your male students to always ask for permission, consent. And what's really interesting when it comes at the fundamental level, doing pericare, these intimate procedures from a male perspective, most fundamental textbooks don't address that. And so I think it's important. It's in the nursing literature. I've done a lot of research on the topic of the male experience in nursing. It was my master's thesis. And so just kind of have some observations as well as what's in the nursing literature on this topic. And so that's as far as I want to go on the male experience. We could also talk about why are so few men in the nursing profession in this generation. What's really, I'll just share this little pearl, and hopefully Sam, I don't see him coming back in yet, so I hope to pull him back in. Technology is that I think he had an unstable connection, but we'll see what happens. But one thing that's really interesting to note is that Florence Nightingale, we love Florence because she transformed the profession, even though men have had a historical legacy of caring for the sick, going back to the BC era of healthcare, the after with the early church, and throughout the last 1600 years of healthcare, men have been participants in some of the monastery orders and other aspects of healthcare. But what's really interesting is that Nightingale basically, was not a fan of men in the nursing profession. In fact, she had some very strict guidelines that men were not allowed to be students in any of the Nightingale schools of nursing, and had even a quote attributed to Nightingale said that men have no place in nursing except where their physical strength is required. And that was the insane asylums of the 1800s, where before antipsychotics, male students were not able to, or male nurses. That was why we have the strong mental health aspect of men in psychiatric care, but not so much in general care. So just some interesting observations there. And I see Sam is coming back. Sam, are you still with us?
So sorry.
I've been rambling about men in nursing for just a little bit. I'm glad to have you back because I'd rather talk about what you have to offer. So let's hope this connection stays stable, my friend.
Sorry about that.
And we'll do that. And so, one question I want to ask you though is that what could have been done differently in your program from just what could you've been taught or just given a heads up on to strengthen transition to real world practice?
Yeah, I think one of the biggest things is just I was thinking a lot about this question, and I think one of the answers is I was thinking maybe creating a class called patient experience, and it being something where you're getting this like practical understanding of what it's like to actually. I talk about it in my book, kind of like just this entering the mind of your patients, because I think it's so easy to see it just in like the nursing world through clinicals or the simulation lab, whatever it is. There's this like perfect cookie cutter way that a patient's supposed to be, and it's never like that. Every patient, regardless of if it's pathophysiology, pharmacology, whatever it is, each patient's different. And then when you throw into the mix too, everyone's at a different place spiritually, emotionally, mentally, or physically. And so I think a big thing is, instead of in practice it seeming to be this one way where this is how the situation is going to go, I think, really being able to understand where your patients are coming from. I think it would be huge in either the nursing residencies, like once you get into practice and you're doing that as a new grad, or even just in pre-nursing school, having a class where you're understanding the whole dynamic that a patient goes through, whether that's trying to understand like financially where they could be at, just like how it would work maybe with social work, with just trying to manage medications. There's just so many things that I think that we kind of expect it to be exactly this way. And then, like me, I get into the real world, and even something as simple as thinking all my patients, they all wanted to get better. Like they wanted to take our help, or that they were responsive and, liked nurses. And I got into the real world, and there's so many people who've had a bad experience, and they don't trust nurses anymore, whatever it is. And I think just a lot of those things could be, we can't obviously prepare for every situation, but I do think we could do a lot better job of just understanding the demographics of just patients, and seeing them as humans and seeing their stories and just understanding how to kind of put all that together. Because I think once you get into practice, there's so many things you have to learn, passing medications, whatever it is, like helping with therapy, whatever thing it is. If we're able to have that foundational knowledge of just how patients are in the real world, then you don't have to try to learn all of that on the fly while you're trying to learn just the essentials of practice in general. So that's probably one of my biggest things that I'd like to see more of.
Yeah, and that sounds like the essence of empathy is just that understanding their lived experience, especially marginalized populations, the homeless or a certain, ethnic groups, cultures. We may not understand it, but we have a responsibility as nurses to really make the extra effort to understand that lived experience. That's going to be different than ours. and really then relate to them on that person to person level still. They're not, and just that, and still demonstrate that caring and that compassion. Great insight, Sam. Thanks
Thank
for
you.
sharing. One of the questions that came in through the chat here is that would like to know, this is from Susan, what you feel affected such a decrease in the number of students that ended up graduating in your class, considering the number of students that started. That's a huge attrition rate. And I'm just, that's not an uncommon problem based on, being a student in that, what did you see that were some of the mitigating factors? What influenced that?
I think for some reason, I don't know if it's like this everywhere, but everyone thinks it's a good idea to be a nurse. And so when almost, I'd say 20 people dropped out after the first anatomy and GOB class for chemistry. They didn't know what to declare as their major. And so they just decided nursing. And I don't know if that was just the financial, you can be done with 4 years and not have to get more schooling. I don't know what it was, but yeah, I'd say probably 20 just from the first week. Another big thing I think is just obviously nursing school is very difficult. And I think a lot of people, I went to a work study school, and so it was maybe a little more time consuming. But I think a lot of people with just like time management, depending on where you're at in life, some people have families, some people have to work multiple jobs, whatever it is. But I think, yeah, for most of the people, we were a really close class. And I can think of one of my friends who didn't make it through. He was only about a semester before completing, and just not really putting in the work that needed to be there. And to kind of talk about that is just we don't want nursing school to be easy, because if it was easy, then we wouldn't be prepared for the way that we should be ready for our patients. And so a lot of people, I think, just it's good. I think nursing programs that are able to kind of weed out people that maybe shouldn't be a nurse or don't have the just the passion to continue learning, or just continue whatever it is, continuing to grow. So that'd be my short answer, I guess.
Okay. No, great insight, Sam. Thanks for sharing. You mentioned before your calling to be a nurse from from that experience at the age of 6 and your strong desire to integrate your faith and practice. I'd like to know what you learned as a nurse now in practice. How can you practically provide holistic and spiritual care when you're stretched so thin and the time demands seem to just make that very difficult? That's a real, because you had that heart to do, and I know you struggled with it and you had some tension. I'd just like you share about this in the book, but I'd like you to just kind of share some insights for the audience.
Sure. Yeah. So obviously the spiritual side of nursing was the most important to me. I kind of wanting to be a nurse to do medical missions. And so I think sometimes I would get myself in trouble by talking too much when I first started out, whether that was in clinical or when I started as a nurse. And I kind of just realized that God is not dependent on me. He's not dependent on any nurse to accomplish his will. And so I think just having to realize that just take that weight off my shoulders, take that burden off my shoulders, and just realizing one of the nurses, I remember, this is one of the biggest stories that stuck out to me in just this spiritual journey, was it's not as much about the words that are said that shows that a nurse is a believer, but it's their actions. And so I think that really helped shape my mind of just working on a step-down unit with 5 patients a day. Sometimes we have five between another 5 and admits and discharges, so a total of 10 that we're taking care of. And at first I expected, I can pray for each patient, I can read the Bible, whatever it was, and just didn't get to do that. And then it was just became realizing practically whether I have the time or not, just the way that I carry myself, and even just a smile can go a lot further than I can expect. And just realizing too that sometimes seeds aren't, I kind of talk about it in my book, sometimes seeds are blossomed with our patients on our shift, and sometimes it's just planting a seed, or sometimes it's watering the seed. But we don't always get to see that long-term growth, or kind of, I guess, that domino effect that takes on sometimes 5 years later. And so those things really helped me kind of just take the burden off myself, but just always be ready for a situation if it came up.
Yeah, no, that's a great insight, Sam. And just that, people don't care how much you know until they know how much you care. and that spirit of how you provide care really makes the difference. And I think that was a quote from one of the early educators, Isabel Hampton Robb, in the turn of the century. But it's the spirit of the nurse that matters. It's how you provide the care that really makes nursing, I think, such a powerful influence, because it's not just doing, it's doing with the right spirit. And it seems like that's what you're saying, correct?
Definitely.
Yeah, awesome. You know, you've been a nurse in practice now, Sam, for 2 years or less. I'd like to know, when did you get the idea to write a book? You know, you're a new nurse, you're not an author, you're just learning the ropes. You're barely just kind of competent as a nurse, according to Benner's Novice to Expert. So you don't have it all figured out, but you felt, I'd like to know, just most nurses don't do this. And so, but you felt, I'd just like to know your story. What was that all
Sure,
about?
sure. So I've always liked to write just since I was a kid, and it's a way that I process. And so for me, it was just kind of like journaling as a kid growing up, and then just anytime. So I started this book actually senior year of nursing school, and kind of as through I'm going through the program, I'm just thinking of all these big perspectives. What things I wish that I knew before I got into nursing school, and I'm writing them down, and then I'm going back later and like expounding on that idea. And then I get into practice, and I had so many students and so many of the big insights I wanted to say. This, like, if I could just tell you one thing this shift, there's so many things, but this one thing, and I would kind of just tailor it to where I felt like they needed to grow. And those things were the same things that ended up, those same students or those faculty that came in said, like, you have so much good insight. Why don't you put it into a book? And it's just funny because I'm so young, and and I just remember one patient, like one of my first shifts that I worked on my own, complimenting my manager about me. And Samuel is way beyond his years. And I felt like I knew nothing. It was like the most basic pathophysiology that anyone would have known. But just taking that intentional time, even if it was like 5 minutes, just to explain at the very like most basic level for that family. And they'd never had that done before. And so I think there's just so many big things that I just realized, and that other people realized, and kind of just like put it all together. And about 2 years now, just kind of working through this whole thing of just what these things I know I would be a lot better at if I would have known them before. And if I can kind of give these things as a jump start to the next generation of nurses, then by all means, like, I'd love to. And I love to help people. And so that's kind of the writing and wanting to help people just felt like a good way to reach a big audience.
Awesome. And Mary asked a question here, Sam. What are the top 3 things you wish you had known, or that you really want to communicate in this book? I'll kind of let you decide how you want to roll with that. But when you look at either as a student, as a nurse, that you wish you had maybe known beforehand more clearly, I think that's probably what I think the context of the question is. So I'll let you, what are your thoughts? What are the top 3? It's kind of like a 3-point boom, boom, boom. What would that be for you that you wish you had known?
Sure. I think one of the first things is just it's okay to not be perfect. I think with the simulations we do, the clinicals we do, the tests we do, it's very, very high standard, and it's almost like you have to have this level of perfection, because if you mess up, your patient's life could be in harm. And that's definitely true. I think it really sets up people, especially for me, just this sense of just like worry, like constant worry that I don't think needs to be there. And I remember the only simulation clinical that I failed was bed making, and I just remember thinking, like, I don't know, it was silly. It was,
I'm a failure already. Might as well just stop. Yeah. If I can't make a bed right,
exactly. And it was just such a small thing. And I just remember seeing so many of my fellow students just in tears, whatever it was they were passing or not passing, whatever their tests were, if they didn't get this perfect A letter that they wanted. And it's crazy. Like, there was one girl below me, she graduated a year ahead of me. She was a volleyball player and also a 4.0 student. And that's crazy, but it's not for everybody. And I quickly realized that I had a 3.2 GPA, which, like, I didn't think was good. But when I went to the critical care unit to apply for the summer internship, they congratulated me for it. and so it's just like one of those moments of thinking back on school, like, you don't have to be perfect. And if you're following a nurse or you're working with a nurse that acts like they have it all together, that's probably a good indication that they don't want to continue to learn. And I guess that kind of brings me into my second point of just it's okay to make mistakes. I think I reflect on a couple of those stories through my book of just really like simple things that like I feel like anyone should have known. But I share that because I think it's so easy to think like, yeah, you have to have it all together. And at the end of the day, you don't. Nobody's perfect. And if you don't, yeah, if you don't have that passion to keep learning, or then I don't know, you can just, I think you can get to a point where you become too prideful. And at that point, you're not going to grow. So I guess that would be number two. And then number three, I think a big thing was, yeah, just this practical side of nursing, just understanding patients. For example, I talk a lot about how I thought all patients, you had either had the right amount of resources to get better, or we're going to use those resources to get better. And it's just not always, it's not always going to happen. Some people with their different lifestyle decisions, they might not be, as wise as we would like them to. And so I think all that kind of wrapped together, just taking it off of the nurse's shoulders, taking it off of my shoulders of thinking like, I have to be the one that's the favorite nurse for this patient, or I have to directly impact this person's life forever, or I have to like fix them for when they go home, like they never come back. And I think I had all those expectations, and yeah, really just realized like it's not true. Like I can't change somebody's entire life. But kind of like I was saying with the spiritual care, if I can just plant a seed, if I could just water a seed, then that's enough. Then I've done my job. But just taking off that concern of like, I have to set up every single resource for this patient to be completely healed. It's just not realistic. And I think in nursing school, the scenarios, even on the NCLEX, are very, you give this procedure and then the patient's good. And realistically, that's just one piece of the puzzle of so many other things that I think are going on in that patient's life. And so just understanding that it's the whole journey with nursing is a journey, and the patients are on a journey, and we're not going to be the ones to, take them across the finish line necessarily. It's a team effort, and it can take years. So I think those are my top three things.
And I kind of like what you're saying, Sam. Is that there's a lot of it. We put burdens on ourselves as students and as nurses in practice, and it's kind of like we've got to recognize that we've got to give ourselves grace to be a student, grace to be a nurse, grace to be human. And that means that sometimes, it's not going to, we can only do so much. We can't influence the choices of another person. We can only, it's like knowing our limitations. And I love, you've got Paula said, what a wise soul in a young body. You are wise beyond your years, Sam, whether you realize it or not. And that's why I really kind of grab it. I just love what you're sharing and what I saw in your book. And, I want to talk about your book in closing here. The name of the book is called Preparing for Practice, Surviving and Thriving in Nursing School and Beyond. And it's a short paperback, about 130 pages. 6 chapters, lots of pithy pearls. I'm going to help Sam I gave him some feedback. He asked for it and I gave it to him, and he's going to do some tweaking. But overall, he writes well. It's I'm really I'm excited just to support him in this self-published work that he actually wants to use to help support his wife and himself on the mission field. And, any proceeds are kind of just going to help support it when that time comes. But I just want to highlight, Sam, in closing, a few things that from the book that I thought stood out to me, that maybe we've talked about a lot of them already. But here's one that I would like you to talk about. You have a quote on character, and this was by another person, but he says that habits are the daily battleground of character. And the daily decisions that we make as a student or a nurse have significance. I'd like you to expound that, because you had some really, I think, for students, when we have plagiarism, cheating, shortcuts, and things that are just not okay. I'd like you to say, Bill, expound on that, please.
Sure. Yeah, I think something I really realized was just the sense of, in my personal life, but also in nursing, just those daily habits, those things that don't really seem like a big deal, they really are. And I really noticed that with when I was teaching students as a nurse, just the trends that are carried on, generationally, like you can go to a different floor and kind of see, depending on the nurses that are there that have influence, and everyone kind of mimics the way that they practice. And so I'm just kind of thinking through nursing school and then even into practice too. Anything that might not seem like a big deal at the time, like over time, if that becomes a habit and it's not a good habit, then it really does form that, like it forms practice. And so I really wanted to expound on the fact of like in your personal life, and then also as you're developing your skills and developing how you want your practice to be, kind of just noticing those things that some nurses do that you like, some things that they may do that you don't like, and just kind of taking the good, taking the bad, and going back to your why too, just kind of meshing that all together of thinking, why am I doing this in the first place, and what kind of nurse do I want to be, and then understanding that every single decision, any shortcut, any just like not loving someone like you should, over time those things can turn to numbing you, especially with the burnout rate so high as well. Just kind of understanding if you can be proactive about those things and realize it beforehand, I think long term it'll reap a lot of benefits.
Yeah. And I'd like to close with one final thought that I saw from the book that we haven't touched upon yet, and that's the importance of you're not above CNA work. You talked about that in your book towards the end, and I'd like you just to kind of like, as a nurse, is there anything that's beneath the scope of the professional nurse? Because there is some of that lack of humility, or a lack of like, that's not my pay grade, that's for the CNA. I'd like you to just touch upon that.
Sure. So I think one of the biggest things in life is humility. Whether I'm learning that in seminary, there's a lot of people who just they want to make the name for themselves, or they just want to whatever it is, just like not listening, not growing, not learning. And I think humility, especially in nursing practice, is such a big deal. I remember like trying to help with making beds to get the next patient in the room, or just doing these tasks that may seem a little mundane to us, and it taking me like 20 minutes. And then one of my CNAs comes in, and within 5 minutes it's done, and it's done way better than I could do. And so kind of just realizing that sense of humility of we're a team, and just like with the body of Christ, and talking about that in scripture, just like how all the units work together in the hospital. Just because you're a nurse doesn't necessarily mean that you're better. You may have more responsibilities, but at the end of the day, like we're all a team, and just understanding how that all flows together. The more people you can have on your side, and the more humble you can be, the more you'll grow, the better your practice is. That's just kind of something I noticed.
Those are powerful life principles, Sam. That's true whether you're a new nurse or you're 30 years into the profession. And thank you so much for sharing. Like I said before, the book has been completed. You did a GoFundMe, and people paid to help you get the expenses to publish the book and do a run of 200. And the bottom line is you don't need any more GoFundMe. So we're done with that. But you're going to publish this after the first of the year. It'll be hopefully available by January, February. What I've got here, Sam, is that is this your website? Tell us how they can get a copy and what you expect the approximate price point to be.
Sure. Yeah. It'll probably be, I was thinking $10 to $12. It's a little bit of a shorter book, but it definitely has a lot of work and effort that I had put into it. And it's going to pretty much help pay for my seminary and help us on the mission field. So it's for a good cause. And I have my website there. It's not developed to purchase on it yet. I'm hopefully going to get it onto Amazon as well. But I think that probably the best way to stay in contact with me, or if you're a nursing educator and you'd like to give it a look to consider for students, I'd be happy to send you a copy once this print run is done. And you can reach out to me with my last name, Womble.
Yep, I got it right here, Sam. Here's your email address.
Great. So that's probably the best way to stay in contact with me. I'd love to talk more. And if there's a question I couldn't get to answering or not in as much detail, I'm happy to respond. I think I was blessed with just a different perspective on the nursing world, and just noticing a lot of things that other people maybe didn't pick up on, or just I'm very intuitive. And so I think the writing really helped me with just processing through things and yeah, if I'm able to help anybody, I'd love that, because that's the goal. It's not about selling a certain amount of copies, but I really care. I care to help, and I thought this would be a great way to do it. So if you'd like to, you can definitely shoot me an email, and we can stay in contact. Yeah, like I said, hopefully gonna have it on Amazon within the next couple months, and yeah, I'd love to help.
And with and with the website, Sam, they can be put on a wait list. So they can just simply go to the website, they can pop in their name and email, and when it is available, they'll get notified, correct?
Yes. Yeah, that would work as well.
Yeah, so that would be a great first step. And your goal is to get it, I mean, even for programs to consider this as like a simple resource for a capstone. Even better yet, they would benefit at the beginning of the program. You've got some great pearls from the entry level there at the very first semester. So it's really, I thought it was very insightful, Sam. And I just want to close with this thought. Students are struggling. New nurses are struggling in that transition. If you were just to summarize just one or two closing pearl that would just kind of, would it be that grace that we need to give ourselves? I mean, what would you say if we could remember, like, one takeaway or one thing to really, whether you're a student struggling or a nurse struggling in that transition, what would be one or two of your best pearls that we've talked about? We talked about a lot of things today. It's been a lot of fun. So how would you condense that? Make that funnel.
Sure.
What would it be?
Yeah, I think, just, finding your why. And once you find that, just reflecting on that through school, through practice, when things get hard. I talk about how there's so many different types of nursing. So if you're finding yourself being burnt out, like, just switch, find something you're passionate about, and don't burn out, because our patients don't deserve that. So find that why, reflect on that why, and also just take the burden off yourself to think you're perfect. Like, you will make mistakes, but the humility there to learn as you go is what makes a good nurse. You can see the nurses that are prideful and that don't provide good care. It's easy to spot out, and so stay humble. And I think a lot of the things that you see in nurses, maybe you don't want to replicate. The humility keeps you from it. So always be practicing, always be working, always be progressing, and always stay loving people, because they're people.
Amen. And they have value. Every person, regardless of their station. So, Sam, I'm just going to basically just kind of like open it up for some questions here. And I've gotten some questions that I've kind of filtered in here. So if you've got a closing question before we call it a night here, this is your last call. Throw a question in the chat, and you know what? We will get to it. I promise you, if you pop it in. But Mila had a really great question I'd like you to answer. She said this. I'll pop it up on the screen here for you. Said, are there nurses who made your transition smooth in practice, or are there still nurses out there eating their young? That incivility, bullying, kind of that hazing. What did that look like for you?
Yeah, there's definitely still nurses out there eating their young, sadly. And I remember getting into my internship during the summer and hearing that term a lot. And it didn't really make sense until it happened to me. And I remember one patient I had taken care of over the course of a couple weeks, probably 3 or 4 shifts, and just making a really good connection. She brought in her pastor to connect with me, and I ended up getting to speak at their church. But I remember one nurse, it was like the Zosin, and I was trying to shake it and get it ready. It's one of those ones that are really hard to dissolve.
Yes, it takes like 5 minutes. It doesn't just dissolve in 20 seconds like everything else, like other IV piggybacks.
It's a nightmare. And some of it that was still clumped together. And the night shift nurse came in, looked at my lines, and like tapped on it and embarrassed me in front of the whole family. And I was just so offended, because I had worked so hard to develop good rapport with the family. And just to call me out in front of them, instead of like, it wasn't even much at all. It was just a simple thing, and it could happen to anybody. And I remember the nurse I followed in the ICU, and she said, I had to figure out everything on my own. I didn't have a nurse residency, so you have to too. And would just leave me in rooms with like 5 IVs, drips that needed to be titrated at the same time. And that's part of the reason I left the ICU, because no one taught me, and it was so scary. And so there's definitely those that do. And I think of my nurse, Ricky, who precepted me on the step down unit. And he was the kind of nurse that would like regardless of charting, whatever it was, like he was there with his patients. Even if he had to stay late afterwards to do his charting, I love that about him. You could tell he really cared about people. And so there's nurses that I think about like that I reflect on, and just I learned so much good from them. And the other people who I don't hold it against them, but I think honestly they probably had something similar happen to them when they were a younger nurse. And so yeah, I think that's why the generational just starting good trends for training for nurses, and just good habits. It really it could be like 20 years from now, but it could make a difference.
Yeah, and we need to be that change, and so it's kind of just because we experience that, we don't have to. We can kind of it's all about respect. It's about valuing and respecting each other as nurses, just like we want to do that for our patients. We've got to do that and not devalue like we did. But totally great, Sam. I got one comment from Paula. She says, Sam, are you willing to do guest speaker spots in our nursing courses? She thinks you have something she'd like to kind of, I think, pull you in on a Zoom and have you share some insights. Would you be willing to do that for, or is that something that your schedule is really tight with seminary and all that you've got going?
Yeah, if it works in my schedule, yeah, I'd love to. The goal with this whole book is just to create good conversations. And I think my goal would ultimately be not volume of books getting out there, but more not quantity as much as quality. And I think my desire is to get this into different nursing programs across the country. And just really have that sense of being personal, So I'd love to do that if we could make that work out. You could definitely send me an email and try and make that happen.
Yep. Good. So if I pop that on the screen there, and that's, I think, an open invite for any educator who would like to just give Sam that opportunity to share some of his pearls and practice with your students. So just something to keep in mind. Just got, I got a question here from Joy. It says, you talked about pairing with the male nurse in clinical was a strong point from school. Are there other memories from school or clinical that were real takeaways from your school that maybe just left a really an imprinted, a very powerful impression? Is there any other things, Sam, that you'd like to expound upon?
Yeah, I think about the nursing school, and I talked a little earlier, but just the holistic sense of caring for patients. And I talk about it a lot in my book too, and how there's a huge difference in saying you're getting admitted a stroke versus saying you're getting admitted a patient whose name is Jim who had a stroke. I think just that even the way that we identify patients, regardless of beyond their diagnosis, is so key. And I loved how they taught that. And also just that holistic sense, but then also just we got to do a simulation on we had a local hospital come in and kind of give us different patient scenarios for what they call a poverty simulation, and just understanding if you only have $300 and you have kids to take care of and phone bills and medical insurance and stuff. Just trying to understand how you prioritize. It's easy to see a patient not taking their meds and just assume they're just being they're just neglecting it. But then at the end of the day, they might not have the resources. Or I think of one patient who thought he was giving himself his insulin, but he wasn't twisting just something simple like the needle on there all the way. He had recently lost his glasses and wasn't able to see like he should, at least clearly. And so he kept coming to the hospital for the same thing. It was high blood sugar because in his mind, he was injecting the insulin, but he wasn't. It was just not understanding how to use the malpractice of the needle, the insulin pen. And after I got to take the time to understand and explain it to him, at least when I was working there, I never saw him again. And so, seeing beyond just that medical picture that we get maybe in a textbook, and just trying to understand how it really is outside of the educational world.
Awesome, Sam. That's a great takeaway. And you know what? That's our final question. And I want to thank you. I'm so glad technology cooperated.
Sorry.
Got you back in the stream with a few minute delay, but it's been worth the wait, Sam. It's been a blessing to have you with me tonight. And you've got some powerful, practical wisdom that we really need to distill to the next generation. So thank you for putting yourself out there, writing a book. You're kind of naked. You're exposing your soul to people who don't, who could misinterpret or this or that. There's a vulnerability. And so thank you. I just want to say thank you for really feeling led to put that together and to just create a very simple resource that can really, I think, plant some very, we were talking about the seeds that you can plant. I think that your book has that power because it's wisdom. It's not just, it's bigger than you, Sam. And thank you for sharing.
Yeah, thank you so much.
All right. It's been a blessing, Sam. You guys have a good night. I hope that you get some just continual, I'd love to see you just continue to just have an influence and an impact in nursing education. We need some of these things in our programs as well as in the profession. So blessings on your journey, Sam, and stay in touch. All right.
Thank you so much. Thank you.
Blessings, guys. Take care. And thank you all for watching. Again, this is archived. So if you would like to share this with your faculty, please go to Keith RN, Think Like a Nurse. And that video link will be there as soon as we're done tonight. And you can share this with your program. And if you found this helpful, love to just get this word out. There's a lot of things that we can learn from tonight's session. So blessings to you, Sam. Have a good night.
Thank you.
Take care.